Okay, this is Damian McNamara with Global Medical News Network at the Skin Disease Education Foundation Women's and Pediatric Dermatology Seminar in San Francisco. And with me is Dr. Jeffrey P. Callan of the University of Louisville in Kentucky. My first question is, how did you learn about the growing connection between insulin resistance and Acanthosis nigricans that you're talking about during your presentation?
And it was clear that there were patients who had Acanthosis nigricans that was seemingly not related to any measurable endocrinopathy other than their being overweight. And at that time, in the mid-70s, it was called pseudoacanthosis nigricans. Subsequently, it's been recognized that most of the patients who had that entity would also when tested, would be able to demonstrate that they had insulin resistance. And so probably their insulin resistance was also related to a reason for them being obese. And then on top of it, it allowed them to get Acanthosis nigricans.
So is this connection widely known among dermatologists?
Well, let's see, I've been talking about it for probably the last 4 or 5 years, so I would hope so, at the number of meetings I go to. But I think it sometimes is a very subtle finding when you're doing an examination, particularly in the case that I was going to use to introduce the subject was a young woman who was being seen for acne, who's overweight. She has really had no menstrual irregularities, but she probably does have polycystic ovarian syndrome, which is also related to the presence of insulin resistance. And basically, the reason that we were alerted to the fact that she was probably insulin resistant was that in doing her complete examination, we noticed a velvety discoloration on the back of her neck in a folded area of the skin, and so made the diagnosis of Acanthosis nigricans, alerted her physician that this was a possibility. She was tested. I don't think that we as dermatologists, though, are going to be treating the patients. I think we're going to alert the patient and the family, and then alert the primary care providers, either whether it's a pediatrician or whether it's a adolescent medicine physician or an internist or family physician, that they ought to do the appropriate testing.
Kind of your take-home message about this, what you would tell the dermatologist when looking for this? I mean, they're obviously going to see Acanthosis nigricans. Maybe they would be the ones who see that, and then they would refer them possibly to someone else to manage the insulin resistance. Is that true? It goes both ways?
Yeah, I think so. I mean, the patient may be sent because either they may come or they may be sent because they've noticed this hyperpigmentation in folded areas of the skin, whether the back of the neck, under the arms. And then us making an appropriate diagnosis, which is a clinical diagnosis. You don't really need to do histopathology. And then alerting the physician to do the appropriate testing, including testing for insulin resistance, but for other endocrine disorders.
This has been Damian McNamara with Global Medical News Network.